Hello and welcome to the Big Picture podcast brought to you by Ipsos. My name is Helen Bennis. Today we are discussing an increasingly important topic. So the nature of online health information, the good, the bad, and the ugly. This is split into a two-part series. This is the first part of the series where we will discuss the good. So the value that accurate, ethical, and regulated health information should have and bring to people in their lives. And the bad, why this value is not being realised. So I'm delighted to be joined by Dr Camilla Stockholm and Dr Stephanie Alice Baker. Welcome both. To begin, please can you introduce yourselves, give a little bit of background about what you do and anything that's relevant to the topic today.
I broadly study the intersection of technology, culture, and society, and particularly applied to the area of health. And what that means is that I'm very interested in how people use various digital technologies to connect online, to form networks and communities online, but also how they use these tools to both access and amplify misinformation. And so that would broadly cover areas such as misinformation, disinformation, as well as generally sharing innocuous health advice.
And you've published lots of papers, written a book.
Yeah, I've written and co-authored 4 books, as well as, goodness, I don't know how many journal articles. Yeah, conferences, the sort of general academic research, and worked with government as well on various select inquiries.
And I believe I saw you on the BBC recently also.
Yeah, I do a lot of media work, which I think is a real privilege because it enables us to share our research with a broader public.
Camilla, what about you?
So I'm a family doctor or GP by background, but I've recently qualified as a lifestyle medicine doctor, which is a quite rare breed of doctor these days. And I think the main reason I was invited is that I'm essentially an accidental influencer. So when I was working as a GP, I was really interested in lifestyle medicine already, and I wanted to empower my own patients to learn about it primarily through food. But as you know, GPs only have 10 minutes, and I thought, I don't know how to explain to a patient what I want them to be eating. So the most convenient time-saving tool was to just show them what I ate myself. And so I set up an Instagram account called What Your Doctor Eats, posted all kinds of recipe reels, and without really meaning to, it went viral. And then the next thing I knew, I was being approached by publishers. So I've also got a book out, and the rest is history, really.
So when you say it went viral, tell us a little bit more about that.
So it was just one recipe that happened to go completely viral. I think there were 1.5 million views, but just that one recipe gained me 70,000 followers. Having had, mostly just a few hundred, mostly just my own patients. And the whole point of it was to support my own patients. It didn't really occur to me that other people would be interested in what I was posting.
So I think it's fairly unanimously agreed that in culture today in society, we have what could be described as universal access to health information online, pretty much universal access. So to that end, almost democratized access to information. This comes with a whole host of things or value that it could add to people and to society in terms of, being or should being a good thing for people. Before we get on to the more sort of nefarious side, can we discuss what this could and should be in terms of, offering value to people in society, having access to this information online?
I hope I don't want to toot my own horn, but I like to think that I'm an example of what could be achieved, because actually my motivations were humble and kind. I was just trying to help my patients in a time efficient way. And if we normalize that in culture and actually encouraged more doctors and healthcare professionals who have the training and know what the evidence base is, if every single doctor showed their patients what they're eating, can you imagine the impact that would have across the world? But of course, that's just not happening. My own patients have come back to me repeatedly, and I often get messages actually of people telling me their cholesterol levels have plummeted, they've reversed their type 2 diabetes, they've gained energy, their IBS has disappeared, all of these amazing results. A lot of them talk about weight loss, which for me is just a pleasant side effect, but I think in society that's the main thing everyone focuses on. But these are actually incredible results that would be very difficult to achieve with a medication. And I think that's what society don't appreciate, that actually a lot of the techniques are humble, they're simple, they're typically very cheap, and it doesn't need to come from someone who's trying to sell you something. You can achieve a lot of these things yourself. The only thing you're missing is knowledge. So it's just to understand what you could potentially achieve, it would be very difficult to quantify, actually.
But suffice to say, impact on outcomes and patients' lives is certainly what you hear in terms of the feedback from patients. Can I then, how is it more impactful doing it in the way that you've done it, perhaps, than, as a role of, in a traditional sort of GP role? Why has it been easier or more impactful, I suppose, to do it in the way that you've achieved?
It's numbers. So it's an example of where social media can be used for good, because medicine is actually very inefficient. I was talking about all of these things with patients, one after the other, giving them the exact same talks and repeating myself. And actually that can be quite boring for you, because you sort of see the next patient. Sometimes it's the exact same problem that you just saw and you've seen it 3 times already, and then you say it all over again. But if you could just echo that to hundreds of thousands of people, then of course you can achieve so much more. So that's one of the good things about social media.
Yeah, I think if you look at the internet and see it as part of media communication more broadly, one of the big impacts is what we refer to as the disembedding of space and time. And what that means practically is that you can communicate with people in different time zones, different temporal spheres, but also different geographical places. And of course, if we look at the internet and digital technologies, it accentuates the speed and scale with which people can communicate a certain message. But if we look at it, and I think you're a very good example of this, it also enables people to achieve followings and fame online. And so all of a sudden we have people who previously would not have been considered, say, celebrities, who were able to build a following and amplify their message to a wider audience. Another dimension would also be the ways in which this can be monetized. And I'm sure later we'll talk about the more nefarious aspects of it, but it's not necessarily always a negative thing. And I think a really important part, if we're talking about the beneficial consequences, particularly of digital communication, is the ability for people to find like-minded communities. And so from a patient perspective, you may have somebody who has a very rare condition. They may follow all the conventional routes, see their doctor, seek medical advice, but not really be able to find people who are experiencing a similar condition and going through the experiences that they suffer on a daily basis. The internet actually allows people, whether it be forums, social media groups, or just blogs in general, to be able to connect with these like-minded communities. And I think this can be a wonderful thing.
And the impact of that, just thinking as you were speaking, equitable health?
When I think of it, I wouldn't think necessarily in terms of equity straight away, but I can see how it could be framed as that, especially through the rubric of democratization. I think as academics, we are quite critical of the idea that the internet has democratized knowledge, because democracy tends to imply this idea about the public, right? The public having an equal voice. And that's not what we see online. Again, we will discuss this later in terms of harms, but it's not an equal playing field. Some people are much more adept at actually building a following online and using certain techniques and tactics to influence and persuade. And also some voices are louder. And we see this very clearly, not only in healthcare, but also in politics.
I just want to come back to you because when you spoke about being able to access so many more people than you could do within your regular GP practice, surely there's an economical benefit to that for a health system point of view.
Yeah, definitely. And I was just thinking about the inverse care law, that typically it's the people who have the income and the ability to access healthcare who get the most healthcare actually, and often they're the ones who need it the least. And then you have people from poorer backgrounds who actually are disproportionately affected by poor health, but they're less able to access the knowledge that they need. And so in many ways, if you have this completely free platform where you have access to a lifestyle medicine doctor who's telling you, this is literally what I want you to eat, let me show you how I make it, it's not expensive food, that's a brilliant thing. And it could potentially save the NHS and other healthcare systems loads of money, because you're preventing future disease and even reversing the disease that's already there. Mm-hmm. So it's a genius idea in theory, but it's just putting it into practice and trying to quiet down the voices that are less helpful.
So that's a lovely lead into so much potential to add value to people's lives and add benefit, but it's not being realised for various reasons. And you both alluded to the fact that that may well be the nature of the information that is available online. So I want to discuss that in terms of how do we define what is good versus what is less good or what is bad.
Yeah, I think the conventional way of understanding it, particularly with regard to health, would be to look at the common terms, misinformation and disinformation. So misinformation generally refers to false or misleading ideas that are genuinely believed to be true. Disinformation, similarly false and misleading ideas, but they are intended to deceive or cause harm. So it's the intention that distinguishes the terms. I don't love those terms because I think that it's not always such a clear divide between good and bad, reliable information and misinformation. And it's very well known in the literature that most misinformation is derived from a kernel of truth and then can become misleading. So I tend to see information existing more along a spectrum where people commit to certain levels of belief or knowledge, and then at times things can be overhyped, and maybe that is unintentional. It's just someone trying to break through the saturated online ecosystem. Or possibly in some cases, it's also more nefarious, where someone is trying to deceive and cause harm. But I think it would be the clearest way for our conversation to try to understand where health information can go awry.
Yeah, I suppose the worrying trend really is that you have to think about how people engage with social media. So what are people actually going to click on? Because time is money. The time that individual spends on your content is money for people. And the content that creates the most traction really is shocking typically, and it really stops people in their tracks, and that's going to make them click on it. But a lot of evidence-based advice isn't shocking. It's not controversial. It's very nuanced. There's a little bit of debate, and that's... It's just such a shame, isn't it? Because then it means that the people who have voices of reason are less sexy, really. And that's where you have a lot of difficulty trying to get your message across.
This idea about good and bad health information, though, is not a new idea.
No, we talked about that before, that you can see this back in history for decades. So you look at the example of the cigarette industry, when doctors were invited to say, oh, Camel is my favourite cigarette of choice. And obviously that wasn't to benefit health, it was for financial reasons. And actually medical staff have been used by advertising campaigns for a very long time to manipulate audiences. And we still see that now, which I find really depressing.
Mm-hmm. So if you were going to define the good and the bad, whether it's along a spectrum or discrete, what is good information from your point of view, from your experience of the influence that you have online? I
think good information it acknowledges the nuance, because it's easy to claim that you're referencing good science, but actually the debate is so much more complicated, because even studies that on the surface look quote unquote good can be biased because of where they got their funding from. And again, you see this through history. So the example that I would bring up is when we were studying cholesterol and the impact that had on heart health, there was a famous study called the 7-country study done by a man called Ansel Keys. And he pointed out, actually, it's the dietary fat people are eating. What people don't realize is that he actually studied 22 countries, not 7. But most of those countries didn't produce the data that he wanted to produce. And so he then encouraged a whole world and lots of governments to push their populations to stop eating fat. But what you don't realize is he was being funded by the sugar industry. And so what happened in society, instead of eating fat, we really reduced the amount that we were eating, but we massively increased simple carbohydrates and sugar and ultra-processed foods. But if the politicians had looked at the quality of his research and asked, well, who's funding it? Then we might have seen a complete change in history.
So it's not just about a reputable source, as indicated by being a qualified medical doctor, or the fact that there's research. There's other things that need to be considered. And I guess that's a nice segue to your research.
Yeah, absolutely. I think part of what makes this whole information space so difficult for a consumer is that even if you want to go in there trusting people, you can't rely on sources in general. And actually, some of the most problematic advice that was shared during the pandemic was from medical professionals who were presenting themselves as contrarian doctors who stood in opposition to institutionalized expertise. And as a byproduct, would then claim a sense of legitimacy through presenting themselves almost like Robin Hood figures who were taking on the establishment. And they would garner a following that way. And of course, if they were ever suspended or had their post shadow banned or removed, they would then use that as evidence that they were being censored and further perpetuate this persecution narrative that would encourage their followers to also fight for truth and freedom and justice. So it does make it really difficult. It makes it really confusing for consumers. I think also it was interesting hearing what you were saying about how, of course, this is not a new problem and the medium changes. We've talked about the internet. And of course, you could look previously, there were a whole series of diet books. I remember when I was growing up, various people would be on diets and reading texts, some of which I think in today's terminology would be classified as misinformation. And then, of course, there's, talk shows and television in the mid to late 20th century as well. And so this isn't new. I mean, I would even look at various healing modalities going back to the late 19th century that we could see as part of this trajectory. But what changes with the shift in these technologies or mediums are the strategies that people use to influence and persuade. And the tools influence people's communication styles to such an extent that even studying the space really closely over the past decade, looking at influencers 10 years ago compared to content creators on TikTok today, their strategies are wildly different in terms of how they try to build a following and spread a message.
How are they different?
Yeah, so if you look back a decade ago at the people, let's use health as an example, given the topic of the podcast. So people who are trying to use social media to either spread a message or essentially sell a product, usually, whether the product be themselves as a brand or some type of, maybe it would be a supplement or some type of breakfast solution. These individuals would often have to spend quite a long time building a following. It didn't happen very quickly, especially if you think about Instagram only really being around for 15 years. So at the time, it did take a long time. It took a degree of skill. It wasn't usually that accidental unless somebody became viral, but in the health space, that was less common. And so the strategies there were really much more about the presentation of the influencer. And I think one way you can understand it is through what I've referred to before as the 3 A's. And I would like to highlight this is not just my idea, it's work with a colleague, Chris Rojak. But the idea there is that influencers would try to establish trust and intimacy with their audience by presenting themselves as accessible, authentic, and autonomous. And this was all built on a series of impressions. So accessibility is this impression of proximity. Unlike a celebrity who appears remote in their achievements. You can't just access them. They have managers, they have agents, they have people who are barriers between you and them. An influencer would appear accessible. They may never respond to your comment, but just by virtue of the fact that you can actually comment on their posts, they may respond sporadically to people. You use the same social media platforms as them. There's this impression of accessibility. And this is heightened by influencers sharing selfies or what I eat in a day videos. It's this idea that they're taking you backstage into their intimate lives. And then secondly, it was this impression of authenticity, this idea that they're genuine and real. Again, the demarcation there is with a celebrity who appears manufactured. They're often paid to endorse products that they don't really use. And it's so common to hear influencers say, I only promote products that I genuinely believe in, that I will genuinely use. So again, authenticity is the buzzword. And finally, in health, it's really crucial that they present themselves as autonomous. And the impression there is one of independence from the medical establishment, from government institutions, and politics more broadly. And really, the big point there is that influencers are trying to communicate that they are not compromised by political or commercial incentives. This idea that they're independent, free thinkers. And it's this combination of accessibility, authenticity, and autonomy that is crucial for an influencer in establishing trust and intimacy with their followers. Now, what's really interesting is just 10, 15 years later, when you look at TikTok and the rise of short video platforms in general, so I would include in that Instagram Reels, YouTube Shorts, the whole medium has changed. No longer is it about following somebody and cultivating a following in order to disseminate your products or brands to a broad audience. It's much more about algorithmically capturing attention in a very brief video. So instead of influence, like I've just described with the 3 A's, what we move to instead is a technique of persuasion. How do I persuade someone? And so we see often with these short videos, they will commence with an emotional hook. Do you want to cure yourself from cancer? Oh, yeah, I think I do, right? Let me tell you how. And it's much less about cultivating a large following. In fact, in recent research that I conducted, many of these videos that were gaining visibility only had a handful of followers, and they were being recommended at the same time as videos where people had hundreds and thousands of followers. But it's much more about engaging viewers and attracting attention and then using that to be able to sell or promote a product. And I would argue that this is actually I'm not sure if you want to speak about it now, but a more concerning shift because it's lowered the barriers to entry. If you think about an influencer, unlike a celebrity, it is accessible in principle to most people who have internet access to some smartphone or a device. And whether they achieve fame or not, in principle, they could try to be an influencer. Increasingly, what we're seeing is people don't need to be an influencer. They don't even need to show their face. In many of the cancer cure videos that I studied last year on TikTok, it was voiceovers where people would show pictures of the Amazon and then try to sell some allegedly natural product. And so instead what we see is this shift to persuasive techniques, rhetoric, ways of actually convincing somebody of the need through especially a highly emotional message to buy a product. And it's just so easy now to be able to do that.
Which I presume makes it very hard for you, who is genuinely putting out authentic information in a context which is just being described by Stephanie.
Yeah, because doctors can't behave like the rest of society. You're being scrutinized all of the time. And I was taught this straight away in medical school. They basically said, you're not allowed to do things that other people can do because if you do X, Y, and Z, then you'll just lose your license. So you give up your entire career if you just step out of line in any way. And that's especially true on social media. So it's not a level playing field, unfortunately, for the medical staff because we need professional boundaries between us and our patients. It feels very uncomfortable being on social media. And if anything, whenever I talk to colleagues and friends, they tease me and it's embarrassing. And when I first started it, I was doing it for very kind find good reasons, but I found the whole process incredibly embarrassing. And I think that's the problem actually for most academics. We were talking about this before, academics and medical professionals. It kind of almost takes away from your you feel it takes away from your credibility if you're then having to post on TikTok and do what the kids are doing. It's not what you were trained to do. We're used to appearing in very formal settings, and again, you want that, especially as doctors, you want that doctor-patient barrier set up so that you can always be seen. You're an authority figure, so you don't want patients to start almost assuming and behaving like they're your friend, because actually that dynamic is really dangerous. There are lots of situations where you might have to say no to patients, or you have to be assertive for their health. And if they start to change the relationship, just psychologically, that's very uncomfortable. So that's something that I've personally really struggled with. And it's why, unlike a lot of these influencers who can do the hooks and they can do all of the viral techniques, I can't do that, because it feels unprofessional for me.
So that's interesting when you said about the doctor-patient dynamic. Clearly there's a different dynamic online. Mm-hmm. So I suppose my question is, could that relationship be reframed to one of partnership and mutual respect?
Yeah, I think so. And that's something I talk about in my book. I think actually the medical model that we're using now is unhelpful. So historically, medicine used to be very paternal. So the doctor would just tell you what to do. And actually a lot of elderly patients come to you and still sort of expect you to do that. And they feel uncomfortable when you're trying to have more of a patient-led approach. But I would say that we've moved in the opposite direction, where actually now everything is sort of heavily patient-centered, and does the reverse. So sometimes actually the doctor is saying to the patient, well, what do you want to do? And that doesn't always make them feel comfortable. My argument in the book was that so many of the diseases that we die from now are chronic diseases driven by lifestyle. And so actually there are so many things about your health that as the doctor, I can't do for you. Actually, you have to do them yourself. And I'm handing a little bit of responsibility back to you, which some people can find difficult. But actually, when you explain it to them and say, well, no, we're a team, so I'm going to do my bit that only I can do for you. I can still write the prescriptions that you do need, or I can write the referrals, but I can't be at home with you and tell you to go to sleep at an appropriate hour. I can't be sitting next to you telling you what to eat. But I can give you the advice, but you need to help me help you. And so I think when you reframe it like that, then actually the relationship, if it's a team relationship, then it's much more positive.
And I wanted to go back to what you said about the restrictions and regulations, because it's not just healthcare professionals operating online, it's broader than that. So life science companies, for example, so pharmaceutical companies, they're unable to interact directly with patients at all. So, for example, if there is an influencer online saying something completely erroneous about their medication, whether that's about side effects or administration, they are unable, at least in the EU, in the UK, to actually contradict that and intervene and say, actually, that's wrong.
Which is crazy, isn't it? And we talked about the fact that you're really stuck. You can't get around it, because every influencer will start by saying a disclaimer, I'm not a medical professional, so obviously you should get your own medical advice, but this is what I think you should do. But the difference there is that they've gained a very unique type of trust and bond with the people engaging with them. And the industry can't compete with that. And actually doctors can't compete with that, because you just don't have that human connection. I think so often what people are looking for, they don't engage with numbers and statistics. That's not an emotional thing. They engage with stories. So if you can see an influencer who's had a weight loss journey, for example, and they tell you how they've achieved it, then of course you're going to follow their advice, because you're connecting with their experience.
And I wanted to bring up this idea of, you mentioned it before, so loudest voice is the one that's heard, and that's not always the best voice.
Yeah, absolutely. So there's been a huge amount of debate, especially since the pandemic, about how to respond to problematic voices online. And I think initially, through the threat of government oversight, a lot of the platforms thought that the best way was to either remove posts if they seemed to be isolated, or if they were repeatedly problematic, to suspend the user. So in both cases, it was really about removal. And I think that can be useful if you look at amplification more broadly and you think about an influencer as a node in a broader social network graph. It can be useful if they are really spreading harmful information to remove them, because you are taking away an extremely loud and powerful voice that has the potential to harm. However, if it's more nuanced than that, and which it is occasionally, then there are other techniques and strategies that can be used. And with various degrees of success, social media companies have tried these and experimented with them. So there's things like labels to qualify something and add nuance. If someone's been spreading a certain message which turns out to be false, some companies like Facebook actually contact those users and message them and let them know. So there are a variety of different techniques, shadow banning, where you limit the reach. And what tends to be the dominant approach now is that everyone is entitled to freedom of speech within bounds and limits, legally usually, but there shouldn't be freedom of reach. And so it's really amplification rather than content creation that tends to be the focus of discussions now. And I think it is important insofar as, we talk about democratization, and I understand that in terms of the internet providing greater access to people, but it's not really a democratic space. There are people who are financed, who have bots and an unfair advantage, whether it be, genuine people online who are supporting them or artificial synthetic followers. And these are not accessible to everyone. And so the modes of influence, we talk about influence operations, it's not a level playing field. And I think that's really important to take note of when we're looking at these more nefarious aspects.
I just want to jump in on that point, because that's so interesting you mentioned that, because I've been approached by so many people. I actually get messages all the time saying, we can get you 100,000 new followers if you just pay this, this and this. And then actually a much more legitimate account, which had loads of followers itself, and a few, I won't mention any names, but quite famous medical accounts were following this account. And they said, you just pay us this and we can guarantee you X amount of followers. And it made me look at these medical accounts who have been my competition, and I realized, oh, you paid for those followers, which is amazing. And I've always refused to do that, because just out of principle, I think that's just not fair. But you're right. If someone has money, that can get them power. And that's ultimately what a following is. It gives you this amazing power that you wouldn't have had otherwise. And I'm a perfect example of that. There are loads of much more senior lifestyle medicine doctors in the world, obviously. I'm relatively young to be in this position, who have never published a book. The only reason I was offered a book was because I had a following. But if you've just bought that privilege, then who are we giving this power to?
Thank you for joining us today. Please do join us again for the second part of this series, where we will discuss the ugly side of online health information. So when and what harm can come from inaccurate, unethical, and potentially unregulated health information, and some of the techniques and advice on how to mitigate these risks for both individuals and organizations.